several serious feline-specific diseases afflict many cats every year. To protect your kitten from contracting a preventable condition, it's critical to have them vaccinated. It's equally imperative to follow up your kitten's first vaccinations with regular booster shots during their lifetime, even if you expect Fluffy to be an indoor companion. The aptly named booster shots boost your cat's protection against a variety of feline diseases after the effects of the initial vaccine wear off. There are booster shots for different vaccines given on specific schedules. Your vet can provide advice on when you should bring your cat back for more booster shots. Though you may not think your indoor cat requires vaccinations, by law cats must have certain vaccinations in many states. For example, a common law requires cats over the age of 6 months to be vaccinated against rabies. In return for the vaccinations, your veterinarian will provide you with a vaccination certificate, which should be stored in a safe place. When considering your cat's health, it's always prudent to be cautious, as cats are often curious by nature. Core vaccines are those that all unvaccinated cats and cats with an unknown vaccination history should receive to protect them against key diseases including enteritis, feline panleukopenia, a parvovirus, and cat flu, feline calicivirus, and feline herpes virus. This vaccination combination is commonly known as the F3 vaccination. Non-core vaccines are those that should only be given to cats in specific risk categories based on an individual risk/benefit assessment, 3, lifestyle, and risk of exposure to the infection of the individual cat. Examples of non-core vaccines include those for feline leukemia virus, FALV, feline immunodeficiency virus, FIV, and chlamydia felis. There may be other non-core vaccines that are available in other countries that are not available in Australia. 1. And these are not listed here. Please speak to your veterinarian for the most appropriate advice for your individual cat. The first core vaccination administered to kittens is from 6 to 8 weeks of age, then every 3 to 4 weeks until 16 to 20 weeks of age. The World Small Animal Veterinary Association, SAVA, now recommends that a booster vaccine is given at 6 months of age to ensure that a protective immune response develops in any cat that may not have responded to any of the first 3 vaccines. It is important to follow this schedule to ensure the vaccines are effective. Please speak to your veterinarian about what vaccinations are right for your kitten, or if you are concerned about your kitten's vaccination being overdue. An adult cat who has received a primary vaccination course will require the core vaccination every 1 to 3 years, depending on the duration of immunity provided by the vaccine your veterinarian uses and the cat's individual circumstances. Check with your veterinarian. If you have a cat who is an adult but has not been vaccinated or whose vaccination history or status is unknown, they will need 2 doses of the core vaccination, 3 to 4 weeks apart. After this, the cat should receive a vaccination every 1 to 3 years. If you're introducing another cat with an unknown vaccination history to your household, if possible, ensure vaccination with core vaccines at least a week before bringing the cat home to meet your other animals. If you are considering breeding your cat, discuss your cat's vaccination needs with your veterinarian and follow their recommendations before breeding. The frequency of feline booster vaccinations varies from 1 to 3 years depending on the vaccine, the disease, and the risk of disease exposure to the individual cat. In general, it is recommended by expert panels on feline vaccination that cats who stay at a boarding cattery require an annual vaccination schedule or a booster vaccine before the cat goes into the boarding facility if the cat has not been vaccinated in the preceding year, as this can be a higher risk situation than a normal home environment. This is because boarding may be stressful for a cat, and stress has immunosuppressive effects which may result in increased susceptibility to infection and disease, and additionally there can be a higher risk of exposure to infectious disease. For these reasons, it is still recommended that a cat should have a vaccination within 12 months of entering a boarding facility, and why almost all cat boarding facilities require cats to have received a vaccination booster within 12 months prior to admission to the facility. It is best to speak to your vet about your cat's individual needs. Your veterinarian will always do a health check before administering a vaccination to ensure your kitten or cat is healthy to be vaccinated. In addition, this provides an excellent opportunity for your veterinarian to fully examine your cat and discuss any health issues. This allows any health concerns that your cat may have to be addressed as early as possible, giving your cat the best chance possible to be healthy and comfortable. After vaccination, the immune system is trained to recognize infectious agents by producing proteins called antibodies or activating specific cells to kill the agents. When a vaccinated cat encounters these agents in the future, it rapidly generates antibodies and activates the cells that recognize the agents, producing an immune response that results in the elimination of the invading agent. While vaccines represent one of the greatest achievements in preventive medicine, no vaccine is 100% effective, and they don't induce the same degree of protection in every cat. For this reason, exposure of even vaccinated cats to other cats or environments in which infectious agents may be found should still be minimized. Vaccinating kittens. Kittens are susceptible to a variety of infections due to their immature immune systems. Vaccination at the appropriate time and minimizing exposure to infectious agents are thus very important, particularly in kittens for which the history of adequate nursing from the mother is unknown. Kittens receive a series of vaccines over a 12 to 16-week period beginning at between 6 and 8 weeks of age. Earlier vaccinations are not effective because kittens ingest beneficial protective antibodies in their mother's milk during the first few hours after birth, but these antibodies also interfere with their responses to vaccines. The antibodies ingested by a kitten while nursing last only a few weeks, so it is critical to vaccinate kittens at the appropriate time to ensure that they are still protected after the maternal antibodies wane. Vaccinating adult cats. Decisions regarding which vaccines to give adult cats and how often they should be administered are based upon multiple factors, including the risk of a cat's exposure to various infectious agents, the duration of protection of a given vaccine, the risk of cats passing diseases to humans, and the rather minimal risks inherent to vaccination, primarily allergic reactions in the short term and the development of feline injection site sarcomas in the long term. Adult cats with unknown vaccination status should be treated as unvaccinated and should receive the full series of vaccines outlined for kittens. Adult cats that are overdue for vaccinations should receive booster vaccines, regardless of the interval since the previous vaccination. Core vaccines. The American Association of Feline Practitioners Vaccination Advisory Panel recommends that all household cats kept indoors at all times receive the following vaccines. Panleukopenia, feline distemper. This highly contagious and potentially lethal virus causes fever, vomiting, diarrhea, loss of appetite, and in some cases, sudden death. Kittens are particularly susceptible. Feline herpes virus, viral rhinotracheitis. This virus causes upper respiratory infection with fever, sneezing, eye and nasal discharge, conjunctivitis, inflammation of the inner eyelids and mucous membranes around the eyes, inflammation of the cornea, keratitis, and lethargy. Kittens have an increased risk of infection. Calicivirus. This highly contagious and ubiquitous virus is one of the major causes of upper respiratory infection in cats. Affected cats may have sneezing, eye and nasal discharge, conjunctivitis, lethargy, loss of appetite, sores on the gums and soft tissues of the oral cavity, and lameness. In some cases, affected kittens may develop pneumonia. In rare cases, a much more virulent strain of this virus can cause inflammation of the liver, intestines, pancreas, and cells that line the blood vessels. This severe form of calicivirus can be deadly in up to half of affected cats. Rabies virus. This deadly viral infection most commonly spreads through bite wounds, but can also be transmitted to any mammal by exposure of an open wound to the saliva of an infected animal. Skunks, raccoons, coyotes, foxes, and bats are the most common wild carriers in North America. Humans are at risk of infection if bitten by an infected animal or if the saliva of an infected animal comes into contact with an open wound. Rabies is routinely fatal once symptoms develop. Feline leukemia virus, FeLV, the leading cause of virus-associated deaths in cats. FeLV spreads through the saliva, nasal secretions, feces, urine, and milk of infected cats. Casual contact, bite wounds, and nursing can all transmit the infection. Roughly 50% of cats diagnosed with FeLV succumb to the disease within 2.5 years. Infected cats may suffer from anemia, immune suppression, and cancer. FeLV vaccination is considered a core vaccine for all cats less than 1 year of age and a non-core vaccine for cats 1 year of age and older that have no potential for exposure to FeLV-infected cats or cats of unknown FeLV status. Non-core vaccines. The decision to vaccinate a cat with a specific non-core vaccine involves a careful assessment of the cat's lifestyle, age, health status, exposure to other cats, and the health of these cats, vaccine history, and, in some cases, medications that the cat is being treated with. With the understanding that all treatment is associated with some risk, the vaccine-specific risk must be weighed against the potential benefit that is unique to each cat's situation. A cat may need additional vaccines depending on its risk of exposure to infectious organisms due to outdoor access, living in a shelter, or being housed in a home with infected cats. Consult your veterinarian to determine if any of these may be appropriate for your cats. Feline immunodeficiency virus, FIV. This viral disease can compromise the immune system, predisposing cats to a variety of other infectious diseases. It is spread primarily via the saliva of infected cats through bite wounds, so transmission among socially compatible cats is rare. Cats that venture outside, where aggression among cats is more likely to occur, are at risk. FIV vaccines are generally not as effective as most other vaccines, and it is difficult to distinguish between a new infection and previous vaccination. FIV vaccines are no longer commercially available in North America. Bordetella bronchoseptica, kennel cough. This highly prevalent bacterium is a common cause of upper respiratory infections, which can cause sneezing, discharge from the eyes and nose, and sometimes a cough. Cats can be infected by direct contact with nasal and oral secretions of infected cats or dogs. B. Bronchoseptica thrives when cats are densely housed, such as in shelters and multiple cat households, and this vaccine is a tool to help control the spread of infection in these situations. Chlamydia felis. This bacterium can cause conjunctivitis and upper respiratory infections in cats. The vaccination can help control the spread of the bacterium in multiple cat environments where verified infections have occurred. Feline infectious peritonitis, FIP. This almost universally fatal viral disease stems from a mutant form of the relatively benign feline coronavirus. The mutation occurs within the individual cat, and there is scant evidence that the deadly FIP form of the virus spreads efficiently between cats, although recent shelter outbreaks suggest that transmission of the lethal FIP form can occur under certain conditions. Most studies indicate that vaccination against FIP is not effective, so FIP vaccination is not usually recommended. Dermatophytosis, ringworm. These fungal infections, which cause hair loss and inflammation of the skin, spread to both dogs and humans through direct contact. Vaccines against the fungal species that cause ringworm are ineffective in cats and are not recommended.